Welcome back for another session. Dr. Tony SEKABIRA still are my names, a chiropractor, doctor, a nutritionist, a physiotherapist, as well as a fitness instructor. Now, today I'm going to talk about ischemic stroke. Ischemic stroke, basically that is pressure. When a person gets hypertensive is all about a cardiovascular. When I talk about cardiovascular, that is the heart as well as circulation of blood. So you find that the veins, they get narrow. So if they get narrow, it causes a tumor that clots, a blood clot, and it causes a tumor which causes insufficiency of blood flow to the brain. So that is a tumor in the brain. So if at all is that insufficiency, that means oxygen is going to be cut off and blood supply is going to be cut off. So the nerves are going to die out. Even the cells, they are going to get damaged and die out. So what happens in the long run? A person gets paralyzed. So by getting paralyzed, because the nerves have died out and there is that paralysis, the nerves as well as the cells. So a person ends up getting retarded. There is speech impairment, the face changes, a person the person can't walk, there's no balance in between that person. So what we do, basically we do what we call a therapy or chiropractic, whereby I stimulate the nerves. We stimulate the nerves in that we reverse the stroke that the person is having. So by reversing, doing stimulation, we also do physiotherapy, whereby we do some simple exercises to rejuvenate, to bring back the body the way it was. Then by doing so, not only do we do only therapy sessions on him, but we also give regenerative medicine in the long run, because now we are tackling the heart. Cardiovascular is with the heart as well as the veins. So what we want is at least to remove that tumor, to shrink that tumor that's in the brain that causes that insufficiency. So after removing that tumor, what we do, I give you regenerative medicine that helps in rebuilding new cells of the entire body. So if at all the supply of oxygen and blood to the brain is sufficient, that means automatically the cells are going to be rebuilt in the body and the person is going to get back to his normal position or normal shape, the way he or she used to be. But again, on top of that, we have to do physio exercises or physiotherapy. So physiotherapy, we do aligning. We align that person in that he or she can get back to the shape, the way he or she used to walk. Then a person, it will take a period of 14 days. There's going to be a drastic change. Once we continue doing the therapy sessions as well as genetic medicine, it will take a patient at least 30 days, 30 sessions. There's going to be a drastic change. But it doesn't stop there. We have to continue, because with reversing a stroke, it can take a period of 3 months. But within those 3 months, according to the response of your body, within those 3 months, at least there's going to be a drastic change. Many patients, within a month, people, they are walking the way they used to. People 3 months, but at most 6 months, the person is back and he or she can even resume his or her own work. So basically, that's it with ischemic stroke. But in other words, ischemic stroke can easily be controlled, because it's all about shrinking that tumor that is in the brain that causes that insufficiency. So if at all we can take away that tumor, we can shrink it, that means within the shortest period of time. If at all we also combine it with genetic medicine, we can rebuild new cells and the person can talk the way he or she used to, a person can feed, a person can walk, even the hand can move. Thank you so much.